Good morning, good afternoon, and good evening to everyone. And thank you for joining us today. It is our great pleasure to welcome you today for this information session focused on the 2021 annual enrollment campaign. However, we also wanted to seize this opportunity to also give you a little bit more details on the plan design, as well as the roles and responsibilities of the health insurance partners. We have decided to organize separate sessions for UN medical insurance plans, so UN-MIP, the UN Worldwide Plan, and then the US-based plans. Today's session is fully dedicated to UN-MIP participants, which will target, of course, all locally recruited UN Secretariat staff, retirees and their eligible family members serving at designated duty stations away from the headquarters. Next Tuesday on 22 June at 9 a.m. New York time as well. So at the same time, the same session will be organized in French. My name is Julie Boré. I'm Communications Officer at the UN Health and Life Insurance section, and I will be your speaker for today. Before I proceed with the presentation, I would like to confirm that a recording as well as the presentation will be published on our brand new website. And that your pre-submitted questions and frequently asked questions will be addressed at the end of the presentation. We will also be happy to answer additional questions, which you can submit through the Q&A of the webinar tool during the presentation. As we might not be able to respond to all questions today, the Health and Life Insurance section, as well as a third-party administrator, Cigna International, take note of all questions and will make sure that they are answered after this webinar. The questions and answers will be published on our website by Friday, 25 June, but you will already find the recording and the presentation later today on the same website. Please find the link to the website at the bottom of this slide. Again, it's a new website, so I definitely welcome you to explore all the information that is provided there. And with that, I would like to take a look at the agenda. There's quite a bit to cover. First of all, today's session will, of course, be dedicated to the 2021 annual enrollment campaign, but as already explained, I will also provide a more elaborate presentation on UN-MIP, some principles, plan design, and of course, the roles and responsibilities. We trust that it's also useful for you to introduce you to the different partners of the different health insurance partners. You will learn who these partners are and each one's roles and responsibilities in allowing us to continue accessing quality healthcare at affordable rates. Afterwards, we'll guide you through the changes effective 1 July 2021. Of course, for UN-MIP, there will not be any changes, but I just wanted to make sure that everyone understands what changes you can make in Umoja employee self-service. So the actions you should take no later than 30 June 2021. In addition, we will also provide you with some changes we can all make to avoid financial surprises and steep increases of future premium, because as you all know, we offer self-funded health insurance plans. Also, the UN medical insurance plan is a self-funded health insurance plan. I'll also give you a little bit more context there on what it means, how we all have to take action again, and how it's our joint responsibility to ensure that future premiums will not increase too steeply. The health insurance section in close collaboration, of course, with our partner Cigna International Health Services, is also continuously monitoring solutions available in the health services space that allow us to take control of our own health. We will also talk about Cigna Global Telehealth today, as well as 2 new communication methods that are offered by Cigna since April 2021. At the end of the presentation, we also have time for questions and answers. Again, feel free to already address any questions or share any questions in the Q&A box. I also want to make sure that in order for us to provide you with the most complete information, with the context and the background we might need in order to respond to your question, ideally we will also receive your duty station as well as the department you might be working in or the mission. So the more details, the better, which will allow us to give you a better guidance today or in the Q&A document that will be provided on our website on the 25th. So that being said, let us look at the participants of today's session. So the United Nations is both the insurer as well as the policyholder, the global insurer and global policyholder of the UN Medical Insurance Plan. Today we have our UN Health and Life Insurance section colleagues also joining us as presenters. And if you have any questions related to retirement, for instance, or of course, as HR partners also related to some changes or updates in UMOJA, or anything you would like to understand on pay files, feel free to also to address them. And then secondly, we have our global third-party administrator, Cigna International, with us as well. Global again, it's the same. We have the same partner, Cigna International Health Services, for all duty stations. So they join us also as presenters. So if you have any questions related to, again, overall benefit coverage or about the provider network, for instance, you can also address them in the chat, and then we will try to respond them today or before the 25th of June. And then thirdly, very important, you, the plan participants of the UN-MIP or UN Medical Insurance Plan. I will start using the acronym from now on, but I think everyone knows that the UN Medical Insurance Plan is the same as the UN-MIP, which is covering locally recruited staff, retirees, and eligible dependents in duty stations away from the headquarters. This is UN Secretariat staff only. Each agency has its own MIP, as you might know. So UNDP has its own MIP, UNICEF, UNOPS, UNHCR, etc. So now that you know who's joining us as during this session, I will also like to introduce you to the different health services partners that make you accessing healthcare or that make it possible that you access healthcare. First of all, there is a United Nations, your organization, your employer, who is the insurer of the UN-MIP. So Cigna International is not the insurer, it's not the insurance company, it is the UN, the United Nations, who is the insurance company of the medical insurance plan. Secondly, as already said, there's a health and life insurance section in the Department of Management Strategy, Policy and Compliance. Global policyholder, not only for the UN Medical Insurance Plan, also plans that provide adequate cover for staff in the US, which are other plans. Why are these other plans? For the simple reason that cost of healthcare in the United States is very expensive, so it would not be fair towards other duty stations if we would just join the medical insurance plan, which is again a group plan. So the utilization of the entire group will translate in higher premiums or will impact the premiums, the future premiums, and it would not be fair towards other duty stations with a high cost of the US that we would also join the medical insurance plan. So the role of HLIS towards UN-MIP is the global policyholder. The next two partners, the global third-party administrator again, Cigna International Health Services. So the entire UN-MIP is administered by Cigna International Health Services. Administrator, meaning that they're only providing administrative services to all of us. So to all UN-MIP members, but also the other third-party administrators in our self-funded health insurance scheme at UN headquarters. The administrators are only providing administrative services. Fourth partner, very important in UN-MIP, is the local managers of UN-MIP, which are your HR focal points and missions. So MIP, the plan, the medical insurance plan, is managed locally, whereas we are the policyholder and decisions and contracts are signed at headquarters level. We really want to emphasize on this very important part that the medical insurance plan is managed locally. So should you have any questions, your HR focal points are also being trained to address them adequately. Of course, we also provide support towards HR partners from within health and life insurance section. But I think this is a very important role and responsibility, of course, that we see for UN-MIP specifically. Then we have the UN-MIP participants. All of you, locally recruited staff again, retirees and their eligible dependents. I will talk about eligible dependents later on. And then, the sixth important partner, of course, in the healthcare chain, so to speak, are the health services providers, right? So these are the doctors, the hospitals, the specialists, therapists, those partners who are providing healthcare to all of you. Why do I include them here as a specific role, as a specific partner? Because there are also some requirements from us towards health insurance, health services providers. Of course, it's not the UN or health and life insurance section that signs the agreements directly with the provider, but we give very clear instructions to the third-party administrators, in this case, Cigna International, on some basic principles where and some basic conditions and rules requirements service providers should adhere to. I'm going to talk, so these were the roles, and you will see here just the definition where you really see the United Nations at the start of the chain, and then Cigna International is more like the facilitator, right? They follow the rules, we decide on the plan rules, Cigna is following these rules. That's really why you see here very clear the six partners again, where United Nations takes on the insurance risk of the UN-MIP, which is completely funded by all plan participants, so staff members, retirees, and also the member states, of course. Member states are contributing the biggest portion of the UN-MIP. As a group, all participants contribute 25% of the total premium, whereas 75% is funded by the member states. And we just have to make sure that we collect sufficient premium to cover the cost of the reimbursement, so the program cost. Then UN-HLIS, we provide comprehensive health insurance plans. I will also talk about what we mean by comprehensive, what kind of analysis we do to ensure that we do provide comprehensive plans to staff, retirees, and eligible dependents. HR and emissions, the managers of UN-MIP, again, a very important role. The managers of UN-MIP at the designated duty stations. Then we have the MIP participants, knowledgeable consumers of healthcare. I will also talk about knowledgeable much more. Again, it's our joint responsibility to make sure that we all contribute to safeguard the sustainability of the medical insurance plan. There's so much information available through your HR partners, but also on the website. So we really encourage everyone to also look for information proactively. Health services providers provide health services, of course, to plan participants at reasonable and customary rates and only medically necessary care. We'll also talk about that later on. And then Cigna International, you will see it here, provides only administrative services to plan participants. Of course, also to health services providers, because a guarantee of payment, for instance, is directly issued from Cigna to the health services provider, and a payment is made for the same. And also to the missions, again, we do provide support to the HR partners. We do provide support to the HR partners, but also Cigna is in direct contact with the HR partners of the missions. The details of the responsibilities. So United Nations UN-MIP is a self-funded plan. It's not an insured plan. There's no external insurance company. It's a self-funded plan. So the United Nations acts as the insurer of the UN-MIP. What does that also entail? It's the United Nations who decide on the benefits that are offered in the UN-MIP. So both the items that are covered, as well as the coverage levels, the regional areas of care, and other concepts. It's a complete decision made by United Nations. Cigna is just following the rules that we stipulate. UN determines who is covered under the UN-MIP, so the fact that it's staff members, retirees, UN medical insurance plan is a mandatory plan. These are decisions made by United Nations. What else? The fact that only primary dependents are eligible to be covered, so children, one or more children below the age of 25, one recognized spouse, but for instance, secondary dependents like parents or siblings, so brothers, sisters, are not eligible to be covered in the UN-MIP. We also decide on the reimbursements methods. I think that is a very important one as well. The fact that most of you are being reimbursed through payroll. And now, of course, I'm talking about staff who do have a pay file, who do receive their salaries. That is a decision made by UN. So we have contractual agreements with Cigna on the average turnaround time in which they have to process a claim, which is 5 working days. Within 5 working days on average, between the receipt of a claim, of a complete claim, and the reimbursement is 5 working days. Of course, as pay files are issued once a month, and payroll runs for UN staff, including all of us, of course, once a month. It means that the reimbursements are paid through payroll once a month. So for instance, if you have a claim, let's say on the 2nd, or let's say, no, let's use another example, on the 29th of June, you submit it to Cigna. Cigna makes a reimbursement within 5 working days on average. So let's say on the 2nd of July, the reimbursement is processed at their end. The pay file left, or the pay file only includes reimbursements up until 30 June. That means that only your salary or your payroll of August will reflect those reimbursements. So it's something very important to take into account. Why are reimbursements made through payroll? For the very simple reason that there's no banking fees related to it. So that is definitely the biggest advantage, that you will not have to pay higher banking fees, bank charges, than sometimes even the total sum of the reimbursement. Defines administrative services the third-party administrator should offer. Again, claims processing is definitely a very important one, but there are also other things like communications, provision of a broad network of providers, service providers, like hospitals. But of course, also we want them to investigate fraud, waste, and abuse. Why is that? Not for their sake, but for our sake. And our sake is not the United Nations, but all of us. We all contribute to the plan. And the higher the expenses, the higher the reimbursements, and the higher premiums we will be paying. So I think that really needs to be very clear. That's a concept of the self-funded plan, and that's also why fraud, waste, and abuse investigation is one of the services we really want Cigna to invest on. UN-HLIS provides health insurance plans. So not only UN-MIP, there are also plans, again, who would provide more adequate coverage, for instance, in the US, who are also much more expensive premium-wise. We provide eligibility files to Cigna. We do that at the start of each month. So whenever there are any changes, Cigna will be notified, of course, through an eligibility file. For staff, it's sent directly from us. For retirees, it's still sent by the offices away from headquarters. This might or should change in the very near future, that retirees will also be reported by headquarters. HLIS reviews the adequacy of the UN-MIP. I know that there have been very limited plan changes in the past, but also the premium has not been adjusted for the longest time. But this is definitely a project that is upcoming. So the UN-MIP will definitely be reviewed, both the design as well as the premium, to make sure that the premium is still adequate to cover the expenses of healthcare. HLIS provides policy and technical support to missions, as said before, and to, of course, regional service centers. Now we have HR and emissions, the managers of UN-MIP locally. They provide training to local staff on UN-MIP, Could be through town halls, could also be just during the onboarding. We are also really rolling out a training schedule. We're also providing supporting documentation. The website is, for instance, a very good way to do that. There are toolkits both for staff as well as retirees, new staff, staff on leave, etc., but also for HR partners to really ensure that the tools are available for everyone to become knowledgeable health consumers. Your HR focal points also process eligibility matters, coordinate payment issues, and collect contributions for ASHI. Also, that last part, we're working on a project to centralize that at headquarters and to make sure that the ASHI contributions are deducted through pension. Of course, processing eligibility matters. It's not up to the HR partners to know when a staff member got married, got divorced, when a child turns 25, although there is an automated termination at the end of that calendar year. But for instance, if a child gets married, a child below 25 gets married or full-time employed, it is of course up to the staff member or the retiree to indicate it, just to warn, to inform the HR partner in order for them to take the necessary actions, make the termination in Umoja for the health insurance coverage. Because if this is not done, of course, afterwards, HLIS, in collaboration, of course, again with Cigna International, they will follow our instructions, will recuperate the reimbursements that were made to a dependent that should not be covered under the plan, for the simple reason that, for instance, the staff member got divorced in the meantime, or the child got married. So from a processing perspective, or at least from a management perspective, it is locally by HR focal points, but of course, we have to understand policy, we have to follow the rules, and we have to understand that, for instance, if we get divorced, that our former spouse can no longer be covered under the health insurance plan. HR partners also gather structural issues. There might be very locally, very specific to the country, to the duty station, or to some services, and then they will discuss it with us, and if needed, also with Cigna, and then we can see if there's anything we can offer support with. Second slide on the plans and roles and responsibilities. First of all, we have the plan participants. As I already said, the plan participants only fund 25% of the total premium, so 75% is covered by the member states. As you all know, premium is a percentage on your salary. I will also talk about it later on. Plan participants understand the benefits that are covered under the UN-MIP. Of course, it is your responsibility. If there's any questions, you can always address them to Cigna. You can always ask for additional support or share a cost estimate and see indeed what would be covered, if it would be covered. But overall, it is, of course, your responsibility as a plan participant to understand the benefits. There is a benefits booklet available on the Cigna website as well as on the HLIS website. And of course, we also have our information circular and the administrative instructions that are again published on our website. Yeah, and all plan participants have to keep the UN-MIP sustainable, right? Again, I think I talked about it already a couple of times. Our utilization impacts directly our premium. It's the group plan. So if we are consuming more than is allowed under the plan, or if we have charges that are not reasonable and customary, we also require from Cigna to only reimburse the reasonable and customary amount of the medical care. But also, of course, there are other ways to be very to contribute. I will also talk about some initiatives later on. Cigna, the use of Cigna Global Telehealth, for instance, it's one key possibility where you will be able to talk to a doctor, international doctor, without any additional out-of-pocket expenses. So I think that is a very, very important one where you can, through an application, schedule a consultation with a doctor. And you can talk to the doctor and it will be at no cost to you. And then the health services providers, what is required from the health services providers? As mentioned before, Of course, they also have to apply the benefits of the plan. If something is covered at 80%, they will have to collect 20% from the patient, or it will be collected through pay file. But that is very important, of course, that the service providers is very well aware of the plan design. They also get the tools and are being trained by the third-party administrators. They only provide medically necessary care. There's a list of exclusions also in the benefits booklet, but of course it is a medical plan, so all non-medical expenses or aesthetical expenses or items that will not cure a deficit or a medical condition are not covered. Just naming some examples. Over-the-counter vitamins, for instance, food supplements, transportation, for instance, from the hospital back home, aesthetical surgeries. All of this is not covered, but of course, again, we have to protect the plan, and the plan is a medical plan, meaning that it only covers medically necessary expenses at reasonable and customary rates. I will talk about what is RNC, or reasonable and customary rates, later on, that we just also have that shared understanding. Health service providers may decide to become part of the Cigna network. Of course, as with every agreement, it's up to the two partners to come to an agreement if the prices are not RNC, or if a provider cannot follow the administrative process that is required from us as a policyholder, then there's no way that a successful cooperation can work or can be established. But it is still, Cigna is still trying to have as networks that are as comprehensive as possible, and there as well, any feedback there might be should be provided to the HR focal points, and then it's up to us to see indeed what can be done in that specific area. And then lastly, the third-party administrator processes claims by following again the plan rules that we stipulated. Respond to inquiries from plan participants, including, for instance, pre-certification or just covered benefits, right? What is covered, at what percentage should something be covered? Provides a medical network of healthcare providers that offer both physical and virtual consultations. I will also talk about the virtual part afterwards, because physical is all known to all of us. Since last year, April, everyone has also access to Cigna Global Telehealth, and conducts fraud, waste, and abuse investigation to protect the UN-MIP in accordance with the services required by the UN. Of course, this is a requirement, a very important one. There's also a fraud awareness campaign. It was launched quite recently. Much more can be found on our website, including leaflets on what is fraud, waste, and abuse, how can you avoid it, how should you report it, what is UN's opinion. So it's an opinion of course, UN's senior management on fraud, waste, and abuse, and how there's a zero tolerance against it. Okay, now that we have this said, so now we know the partners, I will now give you a little bit more details for each partner, so the three main partners, and see indeed if there's any additional questions, of course, at the end, before we jump into the changes you can make. So United Nations, the policyholder, decides the premium rates, the contributions both by staff as well as by retirees, and you will here just find an extract of the information circular, where you will find the percentage of your salary you are contributing to health insurance. It of course depends on the number of family members you enroll, whether it's staff member only or you enroll with a spouse, for instance, and 5 children, then the premium rate will change, as well as the contribution by the member states and the contribution by yourself. Then there are different premium rates for staff on special leave without pay. Why? If you're on special leave without pay and you decide to continue in the plan, then of course you have to contribute the entire portion of the premium. So that's why you will see zero contribution by the organization. And then for staff on special leave with health pay or partial pay, again, it's 50% of the contributions that you will be paying This information is available in the IC. I also added the references at the bottom of the slides just for your understanding. Determines and collects contributions. So this is just an overview on how health insurance works, very, very briefly, of course, but then from an underwriting perspective, where claims need to be paid, right? Claims are paid, and there is a trend that is applied to make sure that to calculate the projected claims for the next year. There is inflation, there's medical inflation that is much higher than the average consumer inflation. And that leads to the projected claims. If we add to the projected claims the fees we pay for the administrative services, we come to the total cost of the program. The total cost is equal to the required premium. There's no margins, no nothing else, again, because it is a self-funded plan. So it is very straightforward. The amount of premiums should be sufficient to cover the total cost of the program. So you also have a very concrete example here with amounts. I'm not going to go into the details, but so this is how it is calculated. And this is, of course, again, an exercise that will definitely be conducted in the next months to see how adequate the premiums still are. Determines and collects contributions. Active staff deducted through payroll. As already said, especially if without pay, there are other provisions. So full premium needs to be paid before the start of the leave. And then depending on the period, a staff member might be away. There can be, for instance, quarterly billing if the leave exceeds the 3 months. Coverage in MIP shall be terminated, of course, if the payments are not received. I think that is very clear. It goes with everything in life. If you don't pay, you don't get services. So that's also the case with special leave without pay. For retirees, contributions should be made quarterly and must be received at least once a month. So still, this is done on the local level, so by the offices, but this will change in the near future. And this will be collected through a pension. Sets enrollment conditions. So participation in UN-MIP is mandatory. For whom? For locally recruited staff members, and then the details indeed on the contract types. All staff members, regardless of the length of the assignment, as of day one, are automatically enrolled in MIP. For staff members, it is an automatic enrollment. Of course, your dependents are not automatically enrolled, and I will also talk about the deadlines there and the occasions to make changes. This month is, of course, one of the major occasions, opportunities to make changes there. It is voluntary for whom? Yeah, for family members, eligible family members. So you don't have to enroll your spouse, you don't have to enroll your children. It is still voluntary, and every year you have again a new opportunity to make changes there, to terminate or add a dependent. And it is also voluntary for retirees. Of course, you have to meet the HLIS. HLIS stands for After Service Health Insurance. It is the same plan that is covering active staff. It's just a continuation of the same plan, and you have to meet the conditions, the criteria for after service health insurance. I'm not going to list them here, but if you go to the STAI, you will also find an overview of the HLIS criteria, the minimum years, contributory years in the health insurance plan, minimum age, etc. Sets enrollment conditions we just covered. The second slide on sets enrollment conditions. So who are eligible family members? Spouses, or at least one spouse per staff member, eligible spouse as recognized by the United Nations. A dependent child until the end of the year in which he or she reaches the age of 25. Disabled child above 25 may also be enrolled. Again, the disability needs to be acknowledged by DMOSH. So our doctors, and for retirees by the pension funds. For HLIS, spouse and children already enrolled at the time of retirement can remain in HLIS, or a newborn that is born within 300 days after retirement. Who is not eligible for family members? Yeah, secondary dependents, as I said, like parents and siblings. And of course, I didn't list it here, but of course, former spouses are not eligible. If you get divorced, for instance, today on the 17th of June 2021, you have to inform your HR partner, and the coverage will cease back to the divorce date. If this does not happen, for sure we will have to refund any reimbursements. If that's not done, it's of course investigated as fraud, waste and abuse. This is very obvious. We have eligibility rules, and the eligibility rules, everyone should follow the same. And we have to make sure that the plan is protected again, because our premiums need to be protected. Married or full-time employed children. So if your child gets married or full-time employed, you will also have to inform your HR partner, and there as well the enrollment in the health insurance plan will cease for that date, on the marriage date or the start date of the contract, employment contract. And then dependents or staff members holding a temporary appointment of less than 6 months, there as well, family members are not eligible to enroll. So this is again a summary. You can always find more details in the STAI, but please keep that very well in mind, because fraud, waste and abuse is not just altering invoices, colluding with providers to invoice or to send an invoice to Cigna for care that was not rendered. It's also not terminating staff spouses, I'm sorry, former spouses or children that got married or full-time employed. Besides on covered benefits, high-level summary of the plan design, again, decided by the UN. Overall yearly maximum per person is 6 times the MIP reference salary. So of course it is 6 times the salary, the reference salary of your duty station. The stop loss limit for active staff, 50% of the monthly net base salary. What is a stop loss? What does stop loss limit mean? I will also talk about it later on. A stop loss means that your total out-of-pocket expenses, as soon as they reach 50% of a monthly net base salary, of your personal monthly net base salary, then an additional coverage level will start to kick in. You will start to receive more coverage. For retirees, again, it's a different concept. It's based on the remuneration. Claim submission deadline is 12 months from the date on which the services were rendered. So you go back to the date of service, for instance, 17 June. That means that up until 16 June 2022, you can submit your expenses with Cigna. Afterwards, there's no way that the claim will be reimbursed. Also because since the introduction of online claiming in the last years, everyone has the possibility to just download the Cigna Health Benefits application, take a picture of the invoice with the supporting documents and submit it with Cigna for immediate reimbursement. They will then again make the reimbursement within 5 days on average after the receipt of a complete claim with all the information that is required by us as the policyholder. And then in the next pay file, you will see these reimbursements reflected. Area of cover. Overall, the UN-MIP is designed to provide adequate coverage locally at a duty station. There are some exceptions. I will talk about the exceptions. It's again adequate coverage. So even if you go to another country which is not part of your regional area of care, the claim will still be accepted by Cigna and reimbursements will be made up to the reasonable and customary level of the care in your duty station. Again, stipulated by us as a policy holder, and there are some exceptions, and I will talk about the exceptions later on. Oh, something I also wanted to add to mention, because I think it's a very nice improvement. Thanks to with the help of Cigna, we were able to, we got a file with all the annual maxima per duty station. So the overall annual maxima, the limits for dental care or other benefits that are a percentage of the annual salary or the UN-MIP reference salary. And I think it will be very useful for you as well to just have a look at it. Of course, it's for 2021. Next year it will be updated, or it might be updated, but then you can always look for the maxima in your duty station. Decides on coverage benefits. Okay, next slide. So for the general cover, the basic cover is 80% for outpatient care. So overall, the concept is 80% outpatient care, meaning that there's no hospital admission, no overnight stay at a hospital. Inpatient care is 100%. These are overall principles. So for the details, go into the benefits booklet, but just to give you a good idea on what is the again the overall concept. Basic coverage is 80%. The stop loss coverage is 96%. If you recall what I told the last slide, so once you have paid out of your pocket 50% of your monthly salary, then the plan will start reimbursing 96%. Of course, this is annually, right? So this is per year. The next year, the counters will be reset, so to speak. So you will just start again as if you haven't contributed anything out of pocket. The ceilings. These are some benefits where ceilings apply. For dental care, it's 50% of the monthly MIP reference salary. This is your ceiling for dental care per year, calendar year, so January through December. When it's dental care after an accident, the benefits will be higher. It's one time the monthly MIP reference salary, or might be higher, because there it will be higher. I'm sorry, it's 1 month of the MIP reference salary. Physiotherapy, as of the 61st session, you require prior approval. Psychotherapy, one time the monthly MIP reference salary again. The hearing aids, it's a fixed ceiling per apparatus. And then preventive care, you will find here what is covered under preventive care. For inpatients, inpatients or hospital admissions, you will see that bed and boards in a semi-private room or ward are covered at 100%. If you decide to go to a private room, which is not covered at 100%, you will have to pay 70% of the cost, or 100%, I'm sorry, you will get reimbursement of 70% of the total room cost, or 100% up to the semi-private room cost, so the higher of the two. Other hospital expenses like medication, MRIs are covered at 100% as well, doctor's fees too. And then personal expenses are not covered. For instance, telephone expenses, additional meals, anything that is, again, not medically necessary, to come back to the concept of a medical plan, is not covered. The regional area of care. It's a lengthy definition, but I'm just going to try to elaborate a little bit further. So what is a regional area of care? Taking into account that UN-MIP is designed to cover care locally. A country of region of a country generally neighboring the duty station of the subscriber and enrolled family members that is specially designated by the United Nations, where they can undergo medical treatment without the need for an approved medical evacuation. So there's no prior approval required. A regional area of care is designated solely owing to the lack of adequate facilities in the duty station or the country of duty station. So it's not up to you or to me to decide that the level of care is not adequate in my duty station. It is a decision that is made by the United Nations, of course, in close collaboration with UN-HLIS, the DMOSH team, with the approval of our senior management, where indeed the assessment was made that in a specific duty station, the basic medical care is not adequate. These countries, and they're very clearly listed also in the information circular, have a regional area of care. That means that if you travel from your duty station to your regional area of care or one of the countries in your regional area of care, you will be reimbursed up to the reasonable and customary level of care in that country of care. So overall, if you just travel outside the duty station, you will be reimbursed up to the RNC level of your duty station. If you stay within your regional area of care, if it's already designated, if your duty station has an established regional area of care, you will receive reimbursements up to the RNC level, reasonable and customary level of that country of care. I took the example here of DRC. Of course, we have a huge population with MONUSCO in Democratic Republic of Congo. So for MIP members residing near the eastern border of the country, they have the possibility to go to Burundi, Rwanda, or Uganda without a prior approval required from a UN physician or HLIS or HR focal point. If you go from the DRC, where you have your duty station, at the eastern border, and you go to Uganda, for instance, for care, you will be reimbursed up to the reasonable and customary care level or level of the care in Uganda, of that cost in Uganda. If you decide to go to Kenya, then you will be reimbursed up to the reasonable and customary level of the care in the DRC. So very important. You really have to understand that if your duty station has a regional area of care, that you have to know what these countries are, and you also have to understand that you cannot just travel outside that regional area of care. Of course, if then again, care can even not be provided in the regional area of care, or specific care cannot be provided in your duty station, this is a other type of discussion, and we're really looking at medical evacuation travel or authorized regional area of care that where the area is not established. So for instance, to give you one example, you are based in, I'm now thinking about a country without a regional area of care. You're based in Ethiopia. You need specific care, which is not available in Ethiopia, but Ethiopia does not have a regional area of care. If the assessment is made by the UN physician with the required approvals, of course, that indeed the care cannot be provided locally, then with the required approvals, you might be granted an approval to go to Kenya, for instance, for that specific treatment. So it's sort of overall endless approval. It's really just for that type of care. And of course, and there's also medical evacuation travel. Medical evacuation really means that there's an immediate need to take action to evacuate a staff member or a dependent of a staff member. This is not applicable to retirees, to another country. Of course, there as well, it is the DMOSH team, the doctors, UN physician, together with the coordination of Cigna International to make sure that the evacuation goes as smooth as possible. This is not, the costs are covered for medical evacuation travel, but not by the plan. It's a separate budget, a separate local budget. If you're traveling to a regional area of care, the travel costs are never covered. So that's also a very important difference. Again, using the example of DRC, the regional recognized medical centers. So these are typically the centers where DMOSH, together, of course, with any additional approvals by senior management, has decided that if care cannot be provided in a specific duty station, these are the countries they will assess to see indeed if the care can be provided in any of these countries. They look at visa requirements, they look at language, of course. There are some criteria that are taken into account to really come to the best location, and of course the quality of that specific care in the country, which is always the main criteria that is being looked at. So then secondly, Cigna issues ID cards. both electronic and plastic. So what's on your ID cards, you will see the reference number, your name, date of birth, some overall identifiers. And then on the back of that card, you will also find the contact information, the dedicated mailbox. You will find the phone number, but you will also find, for instance, the outpatient direct payment percentage, which will be in most cases 80%, and then the regional area of cover if you have if your duty station has a regional area of cover. Then the electronic ID cards will be issued as soon as the file is processed, the eligibility file is processed by Cigna. You will receive a welcome email with an activation email, but of course you're already staff members, so this will not be new to you. But for instance, should you enroll now your recognized spouse during this enrollment campaign, then the same will be received by your spouse. It's accessible, the electronic ID cards, through the Cigna Health Benefits application. So if you then have your phone with you, you always have your ID card with you, or through the Cigna member pages. Next, how to reach Cigna. You can call Cigna. This is a number for Africa and Europe, but there are dedicated numbers per zone. So you will find it also on the back of your card because it's really related to your duty station, or you can find it on the Cigna member pages. You can use a callback feature free of charge, of course, where you go to the Cigna member pages, and under the contact form, you can just ask a Cigna representative to give you a call, which is, of course, free of charge. You can call a toll-free line, but I just want to warn you there that even though there are quite some toll-free lines also published on the website, the availability of toll-free lines, it will always depend on local providers. So this is really out of the control of UN, or it's not in Cigna's control either. So we really have to be very careful there, that you cannot just rely on toll-free lines, which can be resolved because Cigna implemented commercial Skype. So this is a very good alternative to toll-free lines. Since April 2021, and you all received a member email for that, so everyone should have received an email about that change. Everyone has access to commercial Skype. So what you should do, if you download the application, Skype application on your phone, and then you add Cigna Health Benefits to your contacts, and you can contact Cigna whenever you need to contact them. You can also email to the dedicated mailbox for UN-MIP, un.mip@cigna.com. And then, of course, there's quite some communication efforts. Keep an eye on them. So Cigna sends member communications to all the participants. And HLIS, of course, as well. We have our website, but we also often send broadcast messages, which might be one of the main reason or the only reason why you participate to today's session. So please keep also an eye on that communication. Screening and processing of claims is another task, a core task of Cigna. So to identify early fraud, Cigna will always screen claims on the claims analyst level, prepayments as well as post-payment. Of course, screening will be made and it will be done prepayments if done by the claim and the fraud analysts. And all suspicious claims will be sent to the fraud team for further investigation. Claim processing, 5 working days turnaround time on average, and after the receipt of a complete claim. And recuperations for some duty stations, but also reimbursements for all duty stations are done through PayFile. Then offers clinical, administrative support, Cigna Global Telehealth. So it offers, again, free of charge consultations with a doctor, a licensed doctor or specialist around the world through the Cigna well-being application. So before, I always talked about Cigna Health Benefits application, which is the application you will need to access your electronic ID card or look for an in-network provider where you can follow up on your claim settlements. But then there's another application which is called the Cigna Wellbeing application, and that is the application you will use to contact a doctor. Again, free of charge. Please try it out. It can be used to replace an in-person consultation, but also in preparation, for instance, for an upcoming surgery or to seek for a second medical opinion. You can also upload some documents, maybe a medical report you received or a prescription or some other medical details. And then the Cigna Global Telehealth doctor or the doctor that is provided by the partner behind the Cigna Global Telehealth application will be prepared in that call as well. Case management, chronic conditions and decision support are other programs that are offered by Cigna. So to make sure that whenever you're admitted and there is anything, any support needed from a Cigna nurse or follow-up required, this is a service that is provided, and of course, a pre-authorization and guarantees of payments. May I just remind you that pre-authorization is a requirement, it's mandatory for all planned care. So please do so whenever there's an upcoming care, an upcoming surgery, or any other upcoming treatment in the hospital. Then send an email to Cigna and ask for a pre-authorization. You will also receive a copy of the guarantee of payment that is then issued to the service provider in case of whenever it's an in-network provider. Even if you go out of the network, outside the network, still inform Cigna. They might be able to set up an ad hoc direct billing agreement. Ensures RNC a medical necessity. So these are the definitions authorized by the, so Cigna as a third-party administrator is again authorized by the UN to reimburse claims in line with these benefits on the basis of reasonable and customary charges applicable at a duty station. And then what does it refer to? It refers to the pattern of charges for professional and other health services at the duty station, where the service is provided as reasonable and customary or reasonably determined by the third-party administrator. This is, of course, also based on, you know, the claims expertise, the claims data Cigna has as a global administrator, price list of providers. So this is really the knowledge that sits only with the administrator, knowledge that is not available in the health and life insurance section to determine RNC prices. And medical necessity, I'm not going to read the definition, but I think I already made it quite clear that, of course, it's not up to you or me to decide what is medically necessary. Therefore, we need prescriptions, for instance, by doctors and medical reports when required. Controls fraud, waste, and abuse. Very, very important. Again, we had a huge campaign recently. The fraud is a serious offense, right? And it cannot be tolerated. The UN is very firm there. We also have, of course, our OIOS colleagues who are conducting further investigation. Now, should you like to understand more on what is fraud and how you can contribute, you can read a flyer on our website, as well as other information available there. Of course, what actions should you not take? You should not submit or cause someone else to submit false or misleading information. I think that is just the basis, of course. What can you do to avoid fraud from happening? Whenever you receive an explanation of benefits or a settlement note, Cigna has made a reimbursement, you receive a settlement note, you will have to verify indeed if these services were rendered to you. So whether you incurred these services. Were these services that were incurred? Is there anything on the bill that is new to you, or were you even not at all aware of this care being provided? And it's also up to you to inform the third-party administrators, which is Cigna here. So I think yeah, first of all, you should call a provider just to see whether anything went wrong with the billing. And if the answer is still not satisfactory, then you should contact Cigna. Very important. This is a responsibility, a must do. We have to take responsibility and ownership, accountability on issues like fraud, waste, and abuse. UN-MIP, the plan, this is the last portion of the partners. MIP is the same plan again for actives and retirees. It's just called after service health insurance or ASHI for retirees, but the plan is the same. Eligible family members of active staff must enroll. I'm just going to start by the second point because this is very actual. You have to make changes if you like before the 30th of June. Every year, HLIS has its annual enrollment campaign. This means that from 1 June up until 30 June, you can go into Umoja ESS, Umoja Employee Self-Service, and you can make changes. You can add dependents or you can terminate coverage for dependents. The changes will be effective 1 July already. So should you have forgotten to enroll, for instance, a newborn baby within the 31 days after birth in the last plan year or the ongoing plan year, or after marriage, you can still make a change now. Then what is the other opportunity to make changes, if applicable, of course? It's within 31 days after the qualifying events. A list of qualifying events is available on the website, in the information circular. Marriage, birth, death, children getting married, children having full-time employment. These are qualifying events. You have to make changes within 31 days following that event. If, for instance, you give birth today on the 17th of June, you have up until 16 July to enroll your newborn baby. If you don't do that, then your baby will not be enrolled in a medical insurance plan, and the next opportunity is June 2022, and your baby will only be enrolled as of 1 July 2022. So you really also have to take their you have to understand the consequences of not taking any action there. If you know about colleagues who are not joining this presentation who might be in such a situation, I recommend you to also reach out to them directly and warn them of the fact that this month, June, is really the opportunity to make changes, to add dependents or remove dependents from the plan. Covers medically necessary and RNC costs. So again, I think some concrete examples. Exclusions, first of all, what is not medically necessary, as already said, yes, spa cures, any kind of cures, cosmetic treatments. Alternative medicine is not covered. For instance, traditional Chinese medication in countries where it's not prescribed or not part of the medical or not recommended by the medical authorizations or medical authorities, I'm sorry. And food and dietary products is also one of the examples of products that are not medically necessary. RNC costs, what is just a very clear example or small example there. You go to provider A, right? You go to a doctor and the doctor charges you for a regular consultation $10 or the equivalent, of course. Your consultation, because you haven't met your stop loss limits, so your consultation will cost you $2 and the plan $8. So the plan pays $8. If you go to another doctor who does not apply reasonable and customary rates, and who says, you know what, for this consultation, I'll charge you $20, then unfortunately, the plan will still reimburse $8 because that is still 80% of the RNC rate in that country, assuming again that RNC rate in that country is $10, and you will have to pay the $12. So it's really important that, and of course you're more protected there when you visit in-network providers, that the prices that are charged are RNC. Secondly, the RAC and RNC, so the Regional Recognized Medical Center and the Regional Area of Care. This is an example, again, going back to the DRC. For instance, your duty station is DRC, you're in MONUSCO, and you're at the eastern region. And the same consultation costs $10, country of care, in the country of care, which is still DRC, $10, patient share $2, and the plan pays $8. Very similar to the previous example. But you decide to go, for instance, for that consultation to Uganda. Uganda is part of your regional area of care. Your duty station, the same consultation would cost $10, which is the DRC, but in Uganda, the same consultation costs $40. Your patient share will be $8 because it is 20% of the total sum, and the plan will pay $32. If you decide to go outside of your regional area of care, you're going, for instance, to Kenya. Kenya is not established regional area of care for DRC. And the same consultation costs $50 there. UN, or it's not the UN, of course, it's a plan that is funded by all of us, will still reimburse $8, which is, again, 80% of the reasonable and customary price of that consultation or level of that consultation in the DRC. And you will be paying the remainder of the bill, which is $42. Of course, here we're talking about small amounts. We're talking about consultations. You know, if you reflect this to a hospital admission, for instance, I don't have to warn you, I think, about the impact it could have. You can already see that the impact will be huge. So you really have to be very careful there, and you have to be very conscious of the limitations, the territorial limitations of your plan. There are exceptions, of course. The exception is, of course, the exceptions that I gave: established regional area of care, or where care cannot be given with the right approvals from the DMOSH colleagues, the UN physician. Other exception is official duty travel. Of course, only emergency care and official duty travel. If you go on duty travel and you decide to have a procedure done there that could, you know, like wait until you return to your duty station, this will not be reimbursed as an exception. But for instance, you are on duty travel and you need immediate care. There's a condition that requires immediate care. You need to be immediately treated. Then that will also be covered at the RNC level of the country of care, which is in this case the country of your duty travel. The annual ceiling 6 times the reference salary. Again, the limits are published on our website, so I really invite you to go there. I also included it in the presentation. The presentation will be published on the website, so you can also look for the link there. And then I just want to remind you, which is a very nice advantage of the plans, of the UN health insurance plans, that are, again, self-funded. That's also the only reason why this is possible. There is a financial hardship provision after exhausting out-of-pocket. What does that mean? Your limit is your limit, right? Annual limit, and without any acute care that is, the definition is there, so that the event of a major medical expense where the subscriber or the family member is faced with expenses that are so significantly over and above the normal limits, the plan will might reimburse more than your annual limits. This needs to be approved by the specific or the designated approvers, and then your reimbursement, an additional reimbursement might be made with this financial hardship provision. So I think, in addition to a comprehensive plan that is more than above average compared to the average social security system, there's also the financial hardship approval for those expenses that are so over and above the normal limits. Then we're almost there. Latest service updates from Cigna International. I already discussed them, of course, in April 2021. Skype was implemented for all MIP members, and the callback feature is also available on Cigna member pages. I know that especially, of course, again, in a global plan, it might be very difficult to contact a third-party administrator that is not based in your duty station, in your country. This resolves, I think, quite some issues, right? Where you can free of charge talk to Cigna through Skype, or you can send complete a quick form, and then Cigna will call you back to provide more details. Of course, still there's also the mailbox available, and you can write to Cigna directly. If your request is urgent, if it's an emergency, you have to call them. You cannot expect that you need to be admitted within the next 30 minutes. You send an email to Cigna that it will be responded within the 30 minutes. There's also their contractual agreements, and Cigna just have to respond to emails within 3 days on average, written communication. So that's why if, for instance, an urgent guarantee of payment is required, I really advise you to call Cigna, and then they will do everything they can to issue the guarantee of payment as soon as possible to the service provider. And then that's the link I was talking about. So on the HLIS website, we publish the annual maxima per duty station. So you can always have a look there and see what the limitations are for dental care, for your annual limits, and other benefits where indeed the percentage of a salary of the reference salary might apply. Talk to a doctor anytime, anywhere. I'm not gonna talk about it any further because I think we covered it all, but I think what you really have to remind of this presentation when it comes to global telehealth, it is free of charge, accessible through the wellbeing application. And think about it more, it's not just a replacement of an in-person consultation, it's really also, you know, like you don't have the commute time, you don't risk to get sick even in the waiting room. You have quality service providers in your pockets. It's just through an application. And you can just also use Cigna Telehealth in preparation of an upcoming treatment, to seek for a second medical opinion. The doctors take the time to provide any explanations. So I think it is important as well. So please try it out. And then what actions can you take in June? By the June 30th, very important, as of 1 July, you can no longer make these changes. Umoja will terminate any option to make adjustments to your plan. You can review your health insurance coverage in Umoja, so you can see who is already enrolled. And then you can just make changes by adding or terminating coverage for eligible dependents. So how to do that in Umoja ESS? Do you need further guidance? That's possible, that is available, because on our website, on the annual enrollment campaign, you will find 2 job aids, and one of them is really to add or remove dependents from your plan. It's a very good, again, guidance material, guidance documents to use Umoja and to make the changes where needed. The ways to avoid surprises and steep increases of future premia. I didn't state the most obvious ways, which is, for instance, of course, you have to fight fraud, waste, and abuse. That's not just in the common interest of the plan, but also to protect you as an employee. As again, these cases are being investigated and actions are taken upon these findings. You replace in-person consultations with telehealth consultations. If available, you can claim expenses with primary insurance first. For instance, if you are also covered by a social security system or any other private insurance, you can use that first. When surgery is prescribed, a second medical opinion is advisable, again through Cigna, which is in the end also global telehealth. So I really could already advise you to go directly to Cigna Global Telehealth. And you just submit the details and you ask another expert for a second medical opinion. And you can obtain a cost estimate and share it with Cigna for review in case of planned surgery and daycare, so day surgery, for instance. I think that brings us to the end of the presentation. I just wanted to share this one slide. There are two more slides, my apologies. This one is how the provider search section looks on the website. The same is available through the Cigna Health Benefits application. So if you don't know if a provider is in network or the opposite, you have to look for an in-network provider at your duty station in your regional area of care, or if you're on official duty travel and you want to understand what providers are available there in preparation of your travel. You can go to that provider search page, you indicate your country, the city, you indicate a type of provider, for instance, a hospital or a pharmacy. You indicate the specialty you're looking for, and then you will receive a list where you can see, okay, there's a direct billing agreement for inpatient care or a direct billing agreement for outpatient care, or Cigna has preferential rates with that provider, or of course, any combination of these three agreement types. You also have a map, and this is really what you will be seeing, the same view as you will have now on this slide. Any additional questions, visit our website. There's a dedicated page to UN-MIP with details, and then some toolkits available to you as well. Also, events, updates are published on the website, so please go there. Contact the third-party administrator, Cigna International. Many ways to contact them. This is the list, so commercial Skype, callback feature. You have dedicated mailbox. You have the telephone number on the back of your card, and you have the toll-free lines. Again, that last one, it always depends on the availability and the local providers. And then last but not least, of course, there's of course a staff members. This is really for HR partners, because staff members have to go to their HR focal points whenever there are questions, and we are providing that support there. So the contact us form is really for HR partners. If there are still any issues, these can be addressed to us. As a plan is managed locally, as a staff member, you have to go to your HR partner first, and if it cannot be resolved, they will reach out to us through the contact us form. Now we're at the end of the presentation. So thank you very much. I know it was a lot of content. The recording will be available. Slides will be available on the website. We have some time for Q&A. I hope that also some questions are answered in the Q&A box. We do have our two colleagues of the HLIS on the call, Valentina Bono and Wesley Colliser, and I think they have also some questions they would like to guide me through. Is that correct, dear colleagues?
Hello, Julie.
Hi, Valentina.
Presentation, and good afternoon, colleagues all over. So I will start with the first question.
Perfect.
What changes can UN-MIP members make during the annual enrollment campaign?
Yeah, so during the annual enrollment campaign in June, before the 30th or up until the 30th of June, you can add or terminate coverage for eligible dependents. So one recognized spouse is recognized EU MOJA, and dependents as, again, recognized EU MOJA.
Thank you, Julie.
You're welcome.
Okay, Julie. And the second question is, how much will a Cigna global telehealth consultation cost?
Yeah, the global telehealth consultation comes at no additional cost, so it's completely free of charge when you have your consultation. And you, yeah, again, there are many advantages to it. So you just call from the comfort of your home. You don't have any commute time. You might be able also to speak to a doctor in your mother tongue. I didn't cover that part, but it's also available in many different languages. but more information is also available on the Cigna website on the specific languages. And yeah, doctors take their time, and it's 24/7, 365, so you can really schedule an appointment whenever you like. Was that clear, Wesley?
Thank you.
Yes, pretty clear. Thank you.
Thank you, Julie. Now, my second question, I think that you already answered it through your presentation, but just if in case some colleagues couldn't hear or would like to hear it again, this is the question. What are the territorial limitations of the UN-MIP plan?
Yeah, so the MIP is indeed designed to cover care at the duty station. So that is a very important principle. And for each country with inadequate medical facilities, the UN-MIP has established a regional area of care, which we also call RAC. So sometimes you might talk about RAC, which is the regional area of care. It's typically a neighboring country, and it's designated by the UN. As staff members can go there again for medical treatment without any prior approval from Cigna or from HR or from a UN physician. And the costs of that care will be reimbursed up to the reasonable and customary level of that country of care.
Thank you, Julie.
You're welcome.
And Julie, I know that you went through this most of these topics, but what do stop loss clause and out-of-pocket maximum actually mean?
Yeah, so it's very industry. These are industry This is industry terminology. I'm sorry. So I can imagine indeed for us it's it's something it's part of our vocabulary. But if I'm just going to try to explain it once again. But again, if you want, you can go to the website. We also have a terminology page there where it's also explained, and I even think it's also clearly explained in Cigna's benefits booklet. So out-of-pocket maximum refers to the total sum of co-payments paid by all family members in a calendar year. Once the out-of-pocket maximum of covered treatments and services has reached, the stop loss limits defined the stop loss. I'm sorry. Limits is will start reimbursing an additional 80% of the patient share. So 50% is the stop loss limits, 50% of the monthly salary for active staff. Once you have reimbursed or you have paid that, you have paid that amount out of your own pocket, then an additional coverage of 80% will apply, meaning that, for instance, for a regular doctor's consultation, you will no longer be covered for 80%, you will be covered for 96%. I hope this was clear, but again, there's also some examples available in the benefits booklets and the definitions on our website. Thank you.
The next question is this one. Will my newborn baby be covered?
Yeah, well, it will all depend on you. It's an example I also gave throughout the presentation. Yes, so the newborn baby will be eligible for coverage. So what you will typically do is you inform your HR focal point. You make sure that the birth certificate and other information that might be required is provided, and once your newborn baby is enrolled in Umoja or available in Umoja, then within the 31 days after birth, you have to enroll. You have to go into Umoja and also enroll your newborn baby in the health insurance plan. So this is not automatic. It's not because you inform your HR partner that you have a newborn baby, that there's an automatic enrollment of the newborn baby in the plan. You really have to take action again within the 31 days, similar to any other qualifying event. Thank you.
Julie, I would like to add something on this one, since it's a common problem. So the enrolling new baby issue is a problem. Basically, the problem we are having for long. So this might happen because sometimes it might take longer than 31 days to get birth certificate. In such cases, we highly advise HR partners and staff members to use hospital discharge papers for HR partners to add the newborn baby into household members in staff members Umoja record. Once that is done, then staff member will be able to use ESS to add their baby into their plan within 31 days. Well, within 31 days, the enrollment window closes basically. As soon as HR partner adds the newborn baby into household member of the staff members record, enrollment window opens up for 31 days alone, effective the date of birth. So we highly recommend to use hospital discharge papers to approach your HR partners so that they would be able to add your baby into your household members in Umoja.
Yeah, thank you very much, Tulu. And indeed, so don't wait until you get all the documents. You know our policy rules now, and if not, there's still the STIC and STAI where you can read the details that were explained now. It's up to you. If there's any reason why you think you cannot make any changes within the 31 days or you cannot inform HR focal point, it's also your responsibility again to go to your HR focal point and explain the issue. And then we can see if anything can be resolved, even if a solution can be provided. But indeed, to Tulu's point, and thank you, Tulu, there for adding to it, because indeed discharge papers can be issued to HR partners, and then to already ensure that your newborn baby can be enrolled in health insurance. Thank you.
And just one more thing. Basically, we highly advise again HR partners to advise mothers when they request for maternity leave to advise. So while they are processing, while HR partners process maternity leave, they can advise the mothers to provide hospital discharge papers as soon as they give birth in hospital.
Yeah. Thank you, Tulu.
And Julie, another eligibility question. Which family members are eligible to enroll in my health insurance plan?
Yeah, so really the only eligible family members is one recognized spouse, recognized in Umoja as well. And then, yeah, the children also who meet the eligibility criteria. I talked about them here. So it needs to be, your child needs to be below the age of 25, or at least is covered until the end of the calendar year in which he or she attains the age of 25. And then for this children with a disability, other limitations apply or other criteria apply. And then a spouse, so we often receive that request. Is it just, or we sometimes receive that request, I'm sorry, one spouse or certain duty stations also eligible to enroll more spouses? No, it's really just one spouse as recognized. Of course, if you have several spouses, you can just make changes there. Very important also to understand there the limitations. It's also in the IC. But there's a possibility to, for instance, have one spouse covered for 2 years and then make a change in Umoja to enroll your other spouse for a certain period of time. But it's just one spouse at a time. Is that clear?
Thank you.
Julie, the next question is on fraud and abuse. So how can I help fighting fraud, waste and abuse? Thank you.
Yeah. So fraud, waste and abuse is really, again, it's not acceptable, right? So what can you do? There's quite some initiatives you can take and they're all listed on the website, but the easiest one and the first one is, except for, again, not committing fraud, waste and abuse, which is very obvious. Of course, you should not alter invoices. You should not collude with a service provider. It will be investigated, and you don't want to have these consequences, of course. But also, for instance, if someone outside of your control has, for whatever reason, a copy, for instance, of your ID card, goes to a provider, accesses care with your card, then Cigna will process that claim. And you will receive a settlement note, and you will say, hey, but this care was not rendered to me. I did not receive this care, or not on that date, or not these items. You contact the provider, and they say, yeah, someone came to the office desk or to the desk and indeed presented your card, and we did the eligibility checks. Then you have to inform the third-party administrator, of course, and then also their actions will be taken. And Cigna will investigate the matter. So you really have to check the benefits, the settlement note. Also, of course, that's also one of the reasons how a fraud investigation unit can indeed investigate fraud. If you altered an invoice and you have to check your settlement note, and you did not contact Cigna to say, hey, something is off, the amount is not correct, or something else, then of course this is also one of the items that can be used in the investigation. So it's really up to you to check whenever a settlement note is available. You receive an email, you have the Cigna portal, you have the application, and you see, okay, this care was rendered, and indeed this was the amount I should pay for the care, or that I paid already at time of care. So these are the easy. This is the easiest way to take action, Valentina, and of course the website provides some additional tips and tricks. If you still have questions, go to your HR partner and see indeed what else can be done. But I think all the information is already available on our website. Thank you.
Thank you, Julie.
Julie, a question of coordination of benefits. How are benefits coordinated if I'm covered by 2 or more plans?
Yeah. So for those participants who are covered under 2 or more plans, for instance, another insurer or a social security system or something similar, the program, the United Nations program, will coordinate the benefits to ensure that the participants receive the maximum possible coverage, but without, of course, exceeding the expenses that were incurred. So you are expected to inform the third-party administrator, to inform Cigna through the claim form when a claim was already made against another insurer. Thank you.
Thank you.
Hello, Julie. The next question is, can I make changes to my insurance coverage between annual enrollment campaigns?
Yeah, but the only way to make changes is really following a qualifying event. So there must be a qualifying event. There's no other way to make any changes. Even missing the deadline of 30 June is not a qualifying event, of course. You have a month and changes need to be made now. Now, the 31 days following a qualifying event, what are the qualifying events? Appointment or reappointment, transfer or assignment to a new duty station, of course, that will not be too often applicable for UN-MIP participants, marriage or divorce of a staff member, marriage or full-time employment of a covered child, birth, legal adoption or death, and then also the presentation of loss of employment and loss of coverage by the staff member under a spouse's health insurance plan. So if the entire family, for instance, is covered under the health insurance plan of a spouse, which is not a UN member, UN staff, or even a UN staff, of course, and there is a non-voluntary loss of employment, so it's outside your control, the last day of your contract, after the last day of the termination of coverage, or I'm sorry, no, it's not the termination of coverage, the last day of the employment contract, that is a qualifying event, and within 31 days you can enroll in the UN Health Insurance Plan, which is the UN Medical Insurance Plan. These are the qualifying events, but again, a list is also available on the in the STIC, the information circular. Thank you.
Thank you, Julie.
Julie, a life insurance question. Can we also apply for life insurance during the annual enrollment campaign?
It's not related to the annual enrollment campaign, but yes, all locally recruited staff can apply for life insurance. It's also one of the plans that is offered by the UNHQ through an insurance company, which is called the Hartford. Now you hear me say an insurance company because this is indeed the only insurance company we work with for our plans, where indeed the risk is borne by the insurer, not by the UN. There's two possibilities. You can either enroll within 60 days following your appointment. This is unconditional, so you just have to indeed indicate within the first 60 days after your appointment that you wish to enroll in life insurance. And then that's sufficient. Or you have the conditional enrollment should you not have enrolled in the first 60 days. Then there might still be an occasion, but then you have to complete the evidence of insurability form, the Hartford form, which is also on our website. You have to send it to HLIS. HLIS will screen it, review it, and send the same to the Hartford. And then the Hartford might still require additional information like medical examinations to make a decision whether they wish to take the risk or not. So it's not related to the annual enrollment campaign, but of course, locally recruited staff are eligible to enroll in the life insurance plan. Thank you, Wesley.
Thank you.
The next question is about special leave without pay, and it is, what action do I need to take upon return to work following my special leave without pay? Thank you, Julie.
Yeah, so this is also an important update. As of now, you don't necessarily have to take action, or you even don't have to take action when you return from special leave without pay. As you might know, when you return from special leave without pay, you have to be enrolled under the same coverage level as the coverage level you were enrolled in before your leave. And up until a couple of weeks ago, you still had to re-enroll within the 31 days after, or there's still a re-enrollment need to happen in Umoja, whereas now it's automatic. So you return and you will be enrolled in the same coverage level as of day one after your special leave without pay. So there's nothing else required by you. I hope this is clear.
Yes.
Maybe we have time for one more question, and then I would like to wrap up if that's okay.
Okay, Julie. Could you tell us what's the best way to reach the HLIS?
Yeah. So the best way to reach HLIS, it's not very much applicable because the best way to reach HLIS is only applicable for HR partners. If you need a question, if you have a question related to health and life insurance, you go to your HR partner. UN-MIP in the office, your HR partners will give you the response where already available, if they know how to guide you. In the limited occasions where indeed additional support is needed, the HR partner will contact us through the Contact Us form on the website, and then we can just provide the support that is required. So you will not have to directly contact HLIS because you are managed locally and you can count on the support of your HR partner. Thank you. But with that, I think that we covered quite some questions. The questions that are not responded will be responded in again a Q&A document that will be on our website. And later today, you should already be able to access the recording as well as the slides of this presentation on the website. And if there's anything you found very interesting, maybe also for a colleague who was not able to attend, feel free to share it, of course, as well. Promote also the recording and the presentation, because we truly think it might be useful to all plan participants. With that, thank you very much. Thank you also for those in where it's very late already. So thank you very much. And if you wish to attend another session next Tuesday in French, then you're definitely more than welcome. Thank you. Bye.